Hi, I'm Stephanie Patulli for the Sheridan Sun Online. Canadian Blood Services hosted a blood donor clinic on March the 13th at the Trafalgar Campus Athletic Center.
We have a clinic that's hoping to see about 50 units come in. As it's less than 56 days since we were last in the school, we've been able to do promotions within, and the posters seem to have brought in a number of new students to us, and we're very pleased about that. We've also had the benefit of using what we call a life bus, and they've gone into the community to the AMEC building. It's a business here in Oakville, AMEC, and that passenger van for Canadian Blood Services has picked up a half a dozen people, brought them in to donate, and now taken them back to work.
I'm here with Karen, and I want to know why you chose to give blood.
I was really just curious.
And why do you think it's important that other students give blood?
It's probably a real nice thing to do.
I'm speaking to Lorraine, who's a registered nurse at Canadian Blood Services. So what are the requirements for a donor?
Well, first, Stephanie, I'd like to start off by saying that we're glad to be here, welcome to be here, and that we certainly have a shortage of blood, and we're glad to be here collecting today. Our requirements are that you're at least 110 pounds, 17 years old, and you come with a proper piece of identification, such as driver's license or health card. When you come in, you're presented with a binder which goes over information. We have a new arm prep. We have questions about sexuality and sexual practices, as well as what you can expect to find here on our clinics.
How often can someone donate?
They can donate every 56 days. When they come into the clinic, their iron level is tested, and it has to be 125 grams per liter. If it isn't, if it's lower, then you have to wait 56 days before you try. It has to be safe for the recipient of the blood, as well as safe for us to take a unit from you.
Okay, Lorraine, so show me what we have here.
What we have here is how our bags come. Microfarmer is our supplier, and this is how our bags come in the foil pouch. We then will open the pouch. We take 1 unit of blood, which is 2 cups. It takes 10 to 15 minutes on average to collect the blood. There's anticoagulant in the bag so the blood doesn't clot. So once we've taken this 1 unit and it's sent to our lab, the lab will proceed to make 3 blood products. So from that 1 unit that you generously gave, 3 blood products will emerge. It will help 3 different patients. When you come into the clinic, your arm here is prepped with chlorhexidine. The needle goes in. The first thing to fill is this pouch. This pouch here, when it's full of blood, we will take this blood out with test tubes, and this is the blood we send for testing for hepatitis, AIDS, West Nile virus, as well as your blood group.
Well, thank you very much, Lorraine, for speaking to us today.
Well, on behalf of our staff, Stephanie, I would really like to thank you for coming. We serve every hospital towards the Greater Toronto area. We are the only blood supplier in the country. We often transport our blood from coast to coast, and we rely on donors like yourself to help us with our blood supply. And blood, it's in you to give. Thank you for coming today.
Thank you. Sheridan will host its next blood clinic on September 18th. If you would like to donate before then, call 1-888-2-DONATE. I'm Stephanie Patulli for the Sheridan Sun Online.